Good afternoon, everyone. Welcome to our webinar. We are really excited to be here and talk about equine therapy today. I am Jenny Key. I'm a licensed clinical social worker. I've been in private practice in Boulder for about 10 years and doing equine therapy for about that long. And my co-presenters today, we actually all started in equine therapy about the same time and have worked together over the years. So hopefully that means we'll have a lot of interesting stories to share with you about what equine therapy is and how it looks, and that it can be really fun as well as healing. So I'm going to turn the microphone over to Caroline, who will introduce herself.
Hi, I'm Caroline Roy. I'm also a licensed clinical social worker and have worked in equine therapy probably about 19 years, created the nonprofit Rocky Mountain Equine Rhythm. And my background, I'm a family and individual therapist and have worked with systems, probation, social services, and also do family work.
Hello, my name is Karen Eiffert, and I'm also a licensed clinical social worker and an equine therapist. I've been working and volunteering around equine therapy for probably about 14 years now. And I have a private practice in Boulder, and I'm also working doing equine therapy out of Rocky Mountain Equine Rhythm along with Caroline. And I'm really happy to be here. Caroline, do you want to start us off?
Sure. So our presentation outline, which we're going to move right into, the classic horse, the horse is an archetype. So these pictures symbolize what the horse has meant to us on many, many levels. On a mythological level, so the unicorn, the Pegasus, the flying horse, but also as an animal that takes us on a journey, right? An internal journey and external journey. So the horse has been with us for millions of years and has been part of that process with us. So if you can think about how we have partnered with the horse to be able to win wars, partnered with the horse to plow the fields, to journey, main means of transportation as recently as 100 years ago, before the development of the car, and the horse is still used in that way, although its role is a bit less significant given how we've moved into the future. When we think of the centaur, so the centaur is half human, half horse, and so that really symbolically symbolizes our partnership with the horse.
I think the only thing I would add to that piece is, as horses, as humans have evolved over time, if you look at the evolution of humans and how we've changed, even ourselves, if you think about your parents' generation and now our kids and how they're called indigo children, and how they seem to be so spiritual aware and seeking knowledge and spirituality, I think the horses evolved in that way too. So the two kind of parallel each other, which is how equine therapy came into being, and we will talk more about that.
That's a great point. We want to talk a little bit about why we work with horses and people together. And I think one of the really essential pieces of that is that horses are another living, breathing being that stands out from other experiential modalities when it comes to equine therapy, because it's very much about forming a relationship with another being and having connection. That's something that tends to be a little bit missing in our modern technological age. You can't FaceTime with your horse. And that really felt sense that you get with being in the presence of another being really helps you to be very in the moment. You have to be in the moment with horses. They are huge creatures. And if you're not in the moment, you could get moved into, that sort of thing. And they really bring us into the present. The other piece about horses is because they're living, breathing beings, they also need care. And that really For a lot of kids, especially, that ability to actually nurture and take care of another being is something they haven't really experienced. And that it teaches reciprocity. It teaches, not only does this horse carry me around on its back and provide me with a lot of these great feelings, this horse also needs care. It needs me to feed them. It needs me to brush them and pick their feet. And that teaches a work ethic to kids that it's a little harder to teach work ethic in our society with young kids. I grew up on a dairy farm, and we had to work, and it's much different when you're growing up in the suburbs to teach that. The other really fabulous thing that horses teach are communication skills and assertiveness. It's that those relationship skills are essential, and they give us great feedback. I'm going to pass on the baton to Jenny.
Yeah, I wanted to offer an example. One of the things, so Karen, Caroline, and I worked together with probation teens out at the ranch, and we also did an IOP group, so the intensive outpatient substance abuse treatment for adolescents. And part of Caroline's requirement in running Equirhythm was, we come to therapy to deal with our stuff, right? If we weren't on a recorded webinar that was going to be around forever, I'd probably be a little bit more blunt. But the thing about horses is they have a lot of poop. And their Caroline's requirement is that in order to give back to the community and take care of these animals, we have to come out and take care of, just like we have to take care of our own poop sometimes, we have to take care of theirs as well. So I just wanted to speak to that. And classically with my clients, my teens, parents, you might really recognize this. When the kids come out to the ranch, they just want to be ready to ride. They want to have all the fun. And I know probably none of your teens are like this, but I know for my kid, he doesn't tend to like to do the chores to have to get there. And at the ranch, we really require that the teens chip in. I have a girl that constantly struggles with picking up the horse's feet. And she's like, why should I have to do this? You do this. This is your job. I just want to ride. And so that's just a small kind of vignette about what it can look like when your teen comes out to the ranch, or a client in general.
And we often find that there's a willingness that comes out in that when it's for a reason. Kids who, will not load the dishwasher at home are actually really willing to muck a stall or, paint a fence or whatever it takes that day to help make it work with a horse.
Yeah. And speaking of that horse not wanting to pick up his feet necessarily for some of my clients, where you will with me, that speaks to the horses are honest. The next bullet point, horses will not just fake it. As humans, sometimes will sort of kind of allow for each other's ways of dealing without really being, we're either really confrontational or we're kind of passive. And horses will, if a teen or a client, I keep saying teens because that's my area of specialty, but clients in general, if they are not able to be centered in their body, ask and communicate clearly for that horse to pick up its animal or its leg, then the animal just will say, I don't understand what you're trying to ask of me. I'm not going to be vulnerable and pick my leg up off the ground. So horses are incredibly honest and give that feedback without there being a direct confrontation. They do it in a really gentle way, and they're just truthful. And people tend to hear this better from a horse. They can get pretty frustrated. Emotions arise, and that's where we as therapists chime in to help them process that and be with that and use coping skills to deal with the emotions that arise when the horse is honest. And the horse is unconditional. As soon as the human is ready to drop in and be authentic, be skilled, and communicate effectively, the horse will show up pretty much every time, as long as there has been right relationship building along the way.
And horses also mirror what's going on. They do that within the herd, and that's why they're so wonderful to work with your child individually or with the herd or as a family, because they're present. They're present for what's going on, what the dynamic is, and they're going to show you. They're going to, by their behavior, they're going to show you what's going on. And as a clinician, that gives us insight into what's going on within the family system, also internally within that individual person. So I want to share a story with you. It was one of my first experiences doing equine therapy about 19 years ago. We used to work out of Joder Arabian Ranch, which is now owned an open space with the city. And there's a huge arena down below where the horses' paddocks were. And one of the exercises that we work with kids or with adults too, and adolescents, is put several horses out in this huge arena. And the task then is to halter the horse. So while we may or may not show the individual how to do that, part of the process is figuring it out and the struggle. And so there's these three horses, Doc, Bakamir, and Kirk, where the three horses were in the arena. It was in the spring, it was about 100 degrees, and there was lots and lots of fresh green grass around the outer edge. And so of course, what do the horses do? Because horses love to eat, right? So the first thing they did was go to the outside of the arena, or the inside of the arena, but where the grass was, and eat. And I was working with this young girl. She was about 11 years old, and she had a lot of struggles. She had trauma, but she also had a lot of relationship issues within her family and within peers. She was in a specialized school and really was struggling. So after walking around and saying things like, you know, the horse doesn't like me, the horse ignores me, and then she stood in the middle of that arena and held the halter open to the back part of the arena, and started crying. And so part of the role of an equine therapist is to not jump in and rescue. I think as a parent, a lot of times I know that there's that feeling of, oh, my child's feeling a lot of pain, and what can I do? And sometimes we do rescue. Sometimes it's important to step back and let the process happen. And so I stepped back, and this horse, Bakamir, who was one of the original Joder Arabian horses, looked up at her, and I believe read her heart, and walked to the center of this huge arena where she was standing and crying and holding this halter open, and put his head into the halter. Now, that in itself is amazing. My jaw dropped. But I also, that's the intuitive and the connective piece of the horse, is that he knew in that moment what she needed, and he appeared, and he gave her what I couldn't give her as a therapist, which was unconditional positive regard and connection, and that she was okay, and she got that message.
I love that story. It always gives me goosebumps, because I think it demonstrates part of the magic that we cannot just orchestrate. You know, a lot of experiential therapists try to orchestrate these really cool tools and ideas, you know, in a setting, and that just demonstrates the magic that horses offer that you can't fabricate.
Absolutely. So one of the other really amazing things about horses, and things that make them a great partner for equine therapy, is the fact that they're very social creatures. Horses live in herds, ideally. They're very social. They seek out relationship with other horses. And when you walk into the pen, they seek out relationship with you, or at the very least are trying to figure out what your role is in their herd. Within a horse herd, each horse has their own role, whether that be the horse that watches out for what's going on, the horse that's the low man on the totem pole that has to wait to eat, whether that's the nudgy baby horse that's nipping at everybody's butt, or the gelding that keeps that little nudgy baby horse in line. So when we walk in with a herd of horses, they're looking at us to try to figure out what our role is. Horses are prey animals, and as humans, we're predators, which makes us potentially threatening to them. And so they're assessing us and our energy to see if we are potential leaders for them, or if they need to take control of the situation. So that provides infinite metaphors in working with people around social interactions. I love talking with teenagers about what they see in a herd of horses, and how that relates to their peer groups at school. You know, who are the cool kids? Who are the ones that are sitting, you know, at a table by themselves? Who is kind of dominant and aggressive? And what works? And horses also show fabulous examples of leadership. When you look at their herd dynamics, you can see a really positive leader that steps up and is gentle and kind and protective, but firm and assertive. versus a negative leader who might be kind of bossy and pushy and bite other horses and really use more aggressive, more force than they need to keep the herd under control. So there's just, it's a ripe place to learn about social interactions and what works for the individual person.
One of my case examples, I don't know if you remember, Karen, I think you were there for that, was when we were working with the probation kids. They go in and we have the kids, we supervise them, but we have them really feel into their hearts. We try to teach body awareness skills, emotional awareness. A lot of clients that come, adult and child, have trouble really identifying what they're feeling, let alone what to do about it. So we have the kids just kind of do a body scan and be aware of what's going on. And from that heart space, feel out their connection with each horse and then choose the horse that they think they would like to work with, that seems most workable and like they can build a relationship. So one of my guys was very certain that he was going to have this great relationship with peanut butter.
Peanut butter.
Yeah, I knew you would get it. And so he decides, now this guy was one of our tough guys and he did tend to bully, and all of his peers were watching him as he haltered this horse. No problem. We're all kind of holding our breath because we know that peanut butter does not budge unless you are really, really a gentle leader. And this guy got into a pulling match. Of course, we didn't let him do anything to harm peanut butter, but he started to kind of tug on this 1,200-pound animal and got really mad. And then when we asked him what his thoughts were, he said, I think peanut butter is just like me, and this is what I do to people. And the whole group was like, yep. And so we couldn't have taught that. We just had to ask gentle questions and probe a little bit and let the horse do the work.
I already mentioned around their telepathic abilities. I believe Bachemir, like I had mentioned, read this young girl's heart and have the ability to really read what's going on internally with us. And in addition to all of the herd dynamics and the safety pieces. So they're very complex animals, but they live in silence. So they're always reading their environment. They're always making sure that they're safe. And so the piece of communicating from the heart, and then also their powerful healing salve. You know, they tend to kids, like you look at this young girl and you look at the eye of Rosie, and just the softness and the connection between these two beings is just an amazing tonic.
I was thinking of when I first started getting involved with equine therapy. Caroline and I met when we both worked in probation and social services in Boulder County a lot of years ago. And I would be in juvenile court and I would see these adolescents, and I would see, the ways that they had formed to try to have some power in their lives, the ways they communicated with others, with their body language, with their clothing, with their however they communicated, kind of foul language or oppositional defiant kind of behaviors. And Caroline invited me out to the ranch one day to help with some equine sessions. In fact, I was there the day that the horse put his head in the halter, and got to witness that. And what I found is that these same kids who were all that and tough in juvenile court would show up out at the ranch, and their skills didn't work there. Their, tiny tube tops were not very effective when they're running around next to a horse.
Flip-flops.
Their flip-flops, their, all of the, kind of language and coolness and all of that didn't get them anywhere with horses. And so they had to learn a new way of speaking and communicating. And I saw them drop in and be present in a way that I'd never seen them in court. And I'd seen them soften with the horses, the ability to actually be with the creature and be soft and kind, as opposed to this really tough exterior, because so many of them were great kids underneath, but were full of all sorts of adolescent bravado. And that for me was really powerful. And it was kind of the thing that shifted me into seeing this as being a modality I really wanted to pursue and offer to people.
Okay, so what is equine therapy? I feel like we've given you a pretty strong picture leading up to this, but to define it, it's a collaborative effort between a horse and a therapist. So what I want to say about this quickly, and I think Karen and Caroline all agree, is that there are practitioners out there. So I would advise you, just in looking for the right fit, if you're interested in equine therapy, that really use the horse as a tool. They set up situations, for example, a common one is, let's do an obstacle course where if you're working with a group of humans, part of their goal is to get the horse to jump the fence. Well, the way that they get the horse to jump the fence typically is this group of humans tend to band together and scare the horse over the fence. So as a therapist, you might be feeling pretty good, like, yeah, the teamwork, they work together, they accomplished a goal, but how is that good for the horse? And what are you teaching people if they come to you to learn how to improve themselves, the relationship with themselves and others? What are you teaching them if you're teaching them to compromise another in relationship? And that definitely goes for a horse. So we also have a tool bag in equine therapy. There are experiential ground exercises, and it's a very safety conscious environment. So while we're not manipulating or teaching every specific thing and correcting everything that the human does, we do keep them safe. And we have an idea of some ways that the horse and the human can connect that's on the ground. So riding is a graduation of relationship, and it's, the horse is not there as a carnival ride or as a tool to just be taken advantage of, and their backs are sacred. So we honor that in equine therapy. And individuals do come out learning the nuances of horsemanship. So with riding lessons, you tend to show up and the horse can be tacked up for you. Ready, tacked up means the horse has its equipment, its saddle and bridle on. So we learn in equine therapy through the development of the relationship, horse safety and horse skills. And they also, again, offer that unconditional presence and lessons to improve social emotional functioning. So the focus of equine assisted growth and learning is about life skills that can transfer out into the world, but it's really about improving social emotional functioning. And we can talk more later about the different diagnoses.
So I'm going to talk really quickly just about kind of the difference of some of the different horse work that's out there. I think we need to move our. There we go. Oh, wait. I'm going to jump back in our PowerPoint presentation and talk a little bit more about treatment goals. Part of what we work a lot with is relationship building, helping people to learn how to actually interact effectively with another human being. One of the really interesting things is noticing how when someone has to go introduce themselves to the herd, how their anxiety comes up and how they may have every thought that they're going to connect with this horse, but their body energy backs them up and they get anxious, and they actually, right as the horse is ready to connect with them, they give up. So we see that a lot, and it's a great way to help people work through that anxiety that comes in meeting new people. We use a lot of metaphors around those interactions. And also just the experience of being out in nature. It's amazing, just the difference in a human being, myself included, when you set foot on the driveway of the ranch or of an equine facility where you've got nature, you've got horses, you've got animals. It really brings out a different side of people and really helps people to, for a lot of people, especially who haven't been very connected to nature and haven't experienced that, it's a really amazing opportunity to realize what a resource we have all around us, particularly in a place like Boulder.
Mm-hmm.
So equine therapy, in my work in equine therapy is I often will combine other modalities, as do Jenny and Karen. So dialectical behavioral therapy, which is skills of mindfulness and the breath. So thinking about a horse as it holds its breath because they're afraid there might be a predator. The importance of learning to breathe through, and Karen mentioned the anxiety, right? So mindfulness, emotional regulation, distress tolerance, interpersonal effectiveness, all of those skills and tools are so important for all of us, but also for adolescents, children, adults who struggle with those skills. So EMDR, which is a trauma protocol, working with the horses, they naturally, so the bilateral stimulation between the right and left, when you think about sitting on a horse, and as they move forward, they rock back and forth between the right and left. And so your eyes will move back and forth. And that modality is also effective in conjunction with office therapy work with the individual. Cognitive behavioral therapy, helping with behavior techniques, being able to connect their emotions, mind, and their behavior, and shift that and change that if it's causing issues. And then mindfulness, play therapy, and then of course working with family systems therapy aligns so nicely because the horse lives in a herd, and they all have roles in that herd, and so as we all do in our families.
We just got a quick question coming up from Amy, who asked, Amy needs to leave for work, and was wondering if there is a recording available for listening later. And yes, Amy, there will be a recording.
We'll send a replay later today.
We will send a replay out later today. Thanks for listening.
So let's talk a little bit about how equine therapy differs from other experiential modalities. And I've alluded to this already. I have utilized rock climbing, ropes course, not rafting and canyoneering specifically, but hiking, other experiences in nature where you do get that spiritual connection, that feeling of being outside. You can practice mindfulness. I'm a rock climber, so when you climb, there are a lot of metaphors with how you want to give up, what your endurance is like for yourself. Can you tolerate yourself when you're down or feeling like you're not, quote, good enough? So all of those things come out in those type of settings. But again, horses offer that relationship piece. You are, as the therapist, there as a guide, but not the primary relationship point of reference, the horses. So they can bring in those unconditional lessons and love, really, where I do love the rock wall, but it's not quite the same feedback that I get from a horse in terms of being able to create a relationship and really grow and move forward together in working in conjunction with them. And then I also have a therapy dog that I work with, and just in talking with other canine therapists as well as equine, again, horses, I think my dog is amazing and very spiritual, but my clients can still manipulate her. They can bribe her. She's a fairly obedient dog because she's a therapy dog. So she pretty much will listen to them and be there for them. That's a powerful presence in unconditional healing as well. But a horse can't be bribed. I see a lot of my kids coming out with carrots and trying to get the horse to come to them or follow them in the imaginary lead line exercise because they just want the horse to do what they think it should do to make them feel good. So they try bribery. Where that worked with my dog, it doesn't with my 1,200-pound dog, i.e. my horse.
Well, and I think of the power, how amazing it feels to have a puppy sit in your lap and lick your face and just, love you up. And I think if you were to think of that exponentially, that feeling of really sinking in with a horse and to feel that bond with this big being is absolutely amazing. And the other thing about horses are that they not only will teach you and allow you to learn that connection piece, but they also really force you to learn how to use your own personal power. They force you to have to set boundaries, even if you're somebody who really hates to set boundaries. I see this a lot with a lot of the parents that I work with moms who are just trying to keep peace in the house and trying to have their relationship with their child to be strong and pleasant. And horses are fabulous for helping you learn to set boundaries in a way that's kind of neutral. One of the phrases that we use with horses is it's not personal. In a modality we call natural horsemanship, it's very much based on working with your horse in a way that really simulates horse relationships with each other. And you have to learn how to build right relationship in a way that feels fair to the horse. And the greater the connection you have, the greater ability you'll have to be able to accomplish things with them. And horses really require that we stand in our power and be a leader with them and not just allow them to push us over. Mm-hmm. And so I think that's where horses help us learn both ends of the spectrum around how to connect and have that like amazing, yummy, connected feeling, but also have to stand our ground and be assertive and clear. Horses require clarity, like Jenny mentioned earlier. So I think it's just it kind of exponentially provides more exponential opportunities around relationship building.
And I think too, another word that comes up for me is respect, right? Mm-hmm. So respecting the horse, but that horse also respecting you. And so when you think about as you move through the world, that's what you want, right? Relationship, respect on both ends. And that's what, as Karen mentioned, through natural horsemanship and through really connecting and working with the horse, it's really a mutual respect.
So back to the difference between equine therapy, hippotherapy, and riding lessons. We've talked a lot about equine therapy, how that is really looking at social and emotional goals, helping the horse, allowing the horses to mirror our process, to provide a lot of great metaphors for how we behave in the community and with other people, and helping us to be more aware of our body and our speech and how we move in the world. Hippotherapy is more of a physical and occupational therapy kind of activity. The movement of the horse, this is, especially amazing for people with physical disabilities who aren't able to move around as fluidly as the rest of us are. To put someone whose body is pretty rigid, who's been sitting in a wheelchair or, not being able to move, and putting them on a horse and allowing them to experience what it's like to move freely and to feel that kind of massage of their muscles and bones as the horse walks. That's more of a hippotherapy kind of focus, and that's also more geared toward medical conditions, and that has great emotional benefit. And when you're doing riding in equine therapy, there's also a lot of those benefits as well. It's absolutely amazing to have a person riding bareback and experiencing what it's like to feel their body move along with the horse and to learn how to relax into the horse instead of being tight and rigid on top of them.
And that, I think the equine therapy piece, there's a processing element, whereas hippotherapy, there's a little bit of that. But if someone's not a licensed therapist, psychotherapist, then, they most speech and language people and occupational therapists and physical therapists tend to be a little bit more mindful to not go into as much of how does this carry over into the other areas of your life with emotional functioning.
Caroline, you are also a riding instructor. Do you want to talk a little bit about riding lessons?
I can, absolutely. So with riding lessons, it's typically you come in and you are learning about the process of riding. It really is, an instruction and how you sit correctly. And there's many different types of riding, Western, English dressage. And so really the focus is on the right way. So how do you connect with the horse through the bridle and be able to ask that horse to do certain things like walk, trot, canter, collect, turn on the forehand, all of these different riding terms. Horses are trained, and so there's ways to ask them, and there's kind of a universal kind of training out there. And so if you've ever seen the Olympics, they have dressage and they're called dancing horses. And basically it's very, very connection with the rider, but also trained to do certain moves in a very beautiful, elegant way. So, and riding is the primary goal. So we talked a little bit about riding and, use of horses as more of a tool. And so there's some riding instructors that the horse is more connected, and it is really about right relationship with the horse. So for example, not putting someone who's very, very heavy on a small horse. It dishonors the horse, and the rider knows that too. So this might be a horse who is very, very well trained in a certain way, but when you think about weight versus the rider's weight versus the horse's weight, I mean, how much can a horse hold, right? Really honoring that. And we think about the term breaking a horse versus training a horse, and so we have in equine therapy, it's really about training a horse, about that connection. And horses learn, they want to learn, and versus going in like the old cowboys, you know, spurring them and breaking them, which still unfortunately happens. But the wonderful thing with natural horsemanship is that that really has increased our understanding that it really is about relationship. There is something called I think Mustang Million, where, and it's on TV every once in a while, where these natural horsemanship cowboys and cowgirls, equine instructors or trainers, take these horses off the open range, and they have like 90 days or to create relationship and train a horse to walk, trot, and canter. They do that through relationship for the most part, and really the goal. But then again, it's very goal oriented to be able to get on and ride the horse and have it do certain things. Whereas equine therapy really is about that right relationships, which may or may not include riding. Yeah. So there's a question from Nancy, and it says, do you recommend the whole family be part of the child's therapy when horses are involved? Absolutely, absolutely. So important though that when a child is coming for equine therapy, that it's really about that child creating relationship with the horse and with the therapist, and that sometimes takes a process. But I also think it's really important that the whole family system be involved with that. So the wonderful thing about equine therapy is that you can do both. You can work with that child who may be experiencing some emotional or behavioral problems, create connection, create skill that they might model to the family and teach the family about these amazing beings. And then also working with the family. I think I mentioned earlier about the herd dynamic is how is the family interacting? So having the family come in and doing an equine session will be very illuminating to see who takes charge, who's in control, who you know is the middle child who is mollifying the family and caretaking, who's assertive, who's not, and that really helps be able to view the family system in a way for us then as the clinicians to step in and be able to help the family.
I like what you said, though, about giving the therapist, the horse, and the child time to bond, too, because I think in order to really help the child, we do have to understand them in context of their family and help heal all of those relationships. And at the same time, it can be a little tricky. So you want to make sure you have that bond there between the therapist, horse, and child before the vulnerability of bringing in the rest of the family.
Absolutely.
And I think that time when they're bonding is also really important for the child or adolescent to really get accustomed to that environment and to form a sense of mastery. A lot of times kids who end up in equine therapy have been in kind of a disempowered role in their families or in their communities and lives, and the ranch, the farm, can be a really special place for them. And so I think it's a great thing to be able to combine the two.
We have in equine therapy what's called transferring skills as well. So incorporating the family in helps the child to learn, how can I take this great feeling that I have here, or not so great, the vulnerability, whatever comes up in session, and be able to utilize that in a healthy way out in the world. That's really our ultimate goal, is to transfer the skills and not just have it be isolated to, you know, I've given my kids before pieces of the horse's mane to hold and like stroke during class if they have trouble emotionally regulating. But we always joke about bringing the horse to them in their classroom, because especially my ADHD kids sit on top of the horse and they can focus better. That movement that Caroline was talking about is really healing. And at the same time, I've got to teach them to do that outside of the horse environment.
So horses as partners in the therapeutic healing process can benefit from, there's many different groups that can benefit from equine therapy. Is it the panacea for everyone? No, it's not. And so part of our job as clinicians is to be able to say, is this appropriate or not? So at-risk youth, families, victims of crime, parenting groups, therapeutic group homes, awesome working with groups and families, also grief groups. So horses are so amazing. Karen and I had the honor to work at Joder Ranch, where there are many older horses. And so we witnessed and many horses passing, and to be present for that, while it's very difficult and painful because you're saying goodbye, it also is just such a wonderful way to be present and there, and to be part of that process. And we learn about death, and we learn about transition with these creatures that we've come to know and love.
I think that was one of the it was a real real gift to be able to be involved in that with kids and families. I think that in our current society, we're not as exposed to that cycle of life. You think about a town like Boulder, a lot of the grandparents or great grandparents aren't even in town. There's not that kind of multi-generational community experience that a lot of people experience, and even experiencing it with animals. And so one thing that really comes to mind, we had a good community of, whether there were kids there for riding lessons or equine therapy kids, they would be there when a horse would need to be put down or buried, and to be able to really be there and walk them through that process, help them to understand what's going on. And one incident that really comes to mind for me is a young woman whose mom was there as well, and the mom had lost her own mother to cancer when she was young, and her family didn't work it through. They stopped talking about her mom, or her death. And so she said, I haven't really been through this much myself. And so helping she and her daughter together to be able to get through her daughter's horse that she loved being put down and buried. And it was just a very healing experience. It teaches the cycle of life in a way that we don't often experience in our society.
Okay, so let's talk a little bit more specifically about diagnoses. I think sometimes it's easy for us to say, when we feel that horses are so healing, that there's a way that horses can always help. But we'll talk about a few ways where it might be contraindicated, and to be mindful of that. That doesn't mean if someone that isn't right for horses at some point couldn't come back later. But horses can be really powerful with abuse and neglect in healing trauma and post-traumatic stress disorder. If you think about all the work being done now with veterans coming back from the war, and how they find that unconditional presence, acceptance, love in horses, that sitting in an office probably may just trigger their stress and their trauma more. Attention deficit hyperactivity disorder. So I talked about how a lot of my ADHD clients have the ability to actually focus and have complete thoughts and have reciprocal conversation when they're on top of a horse or interacting with the horse, because they require such presence. Conduct disorder and oppositional defiance. I gave you the example of peanut butter, and I'm pretty sure that young man probably had a nice feeling of opposition in him, and he wasn't able to get far with the horse until he admitted that maybe wasn't the best way. So sexual perpetrator behaviors. I don't know if you want to speak to that, Caroline.
Right. There's a program, or was a program, I'm not sure if they're still around, but in Colorado Springs area, that works with sexual perpetrators with actually mini horses. So, and what we find with the smaller horses, the ponies, they can be pretty tough cookies. I mean, you think a big horse sometimes is hard to move. They are very, have strong personalities, at least the horses, the ponies I've worked with. And they've been working with them around basic horse skills, being able to assert themselves, to be able to set boundaries with the horses, but also honor the horse, see that the horse is different from themselves. And of course, in situations in working with sexual perpetrators, you have to have it very, very structured, very monitored. But down at Canyon City, there is a program with the Mustangs, with the horse program. They bring Mustangs in, and they have inmates work with them, gentle them, and get them ready for sale. I'm not sure whether or not they work specifically with sexual perpetrators, but definitely working. There are programs that do work with sexual perpetrators.
It's all about that power over too that
Yeah, oh,
Caroline
absolutely.
was talking about
Absolutely.
earlier with the horseback riding and
Yeah.
the training, is that it's with this is about right relationship and not trying to overpower another being. So I think that's where the key is, which going back up to abuse and neglect, I feel like I glossed over that, but a lot of kids I've worked with in either foster care or that have been removed from their homes or abused and neglected in some way, they can find a lot of unconditional acceptance and love and almost identify with their survival instincts with the survival instincts and the prey instincts of the horse. So I'm going to jump down to adoption and attachment and just kind of link the two together, because again, kids that have been adopted and have attachment difficulties in terms of building and maintaining healthy relationships, the horse again provides a gentle way of doing this, and they really relate to each other because the horse's brain goes quickly into fight or flight for very little reason when they feel threatened, as do a lot of kids that suffer with attachment issues and adoption. And a lot of horses change owners frequently or have their own stories that they come with. So as a child starts to get to know a horse, they get to learn about how their stories might be similar and how they can heal themselves together or identify just with that story. So then going back up to autism, horses, there's a classic example of autistic people that have difficulty having speech at all or having an external experience. It's like they have their own language. And so they really relate to horses. Dr. Temple Grandin is a great resource for this. Animals in Translation is one of her biggest selling books. And I would just encourage you to read about her and her work with animal behaviorism, and it can identify how autism can be helped by animals.
I did my training at a therapeutic riding program in New Hampshire, and they had a lot of groups for kids with autism, kids on the spectrum, and it was pretty profound. There were children there whose parents had spent the entire year before trying to get them at the farm. They would drive by the mailbox. They would, one day they would stand on the driveway. The next day they might drive into the barn. The next day they might stand by a horse pen and look at a horse. Some of these kids, their fear of change and new environments and unfamiliar things was so strong that it took that kind of groundwork to get them into the barn. But what we saw was unbelievable in terms of their ability to connect with the horse, and how a pretty nonverbal kid would just perk up and talk at times. Or I think the other really interesting thing, I work with a lot of young adults on the spectrum, in the higher end of the spectrum, and they a lot of times have a huge fear of doing anything unfamiliar, and this very rigid wall comes up when something unfamiliar comes up. And the beautiful thing about horses is that there is a natural motivator to get results, and a natural motivator to keep working through those things that are scary. Caroline and I worked with a young man that it took him 2 weeks to get on the horse. He would stand on the mounting block and scream and freak out and kick the mounting block underneath the horse and jump off. Luckily, we had an amazing horse that helped partner with him to work through those issues. But and he was a young man who providers had said they really didn't expect him to ever really participate in normal classroom activities and really be mainstream. And he has been starring in school plays and running for class office and doing very well as a teenager. And so I think that the work with the horses was a very pivotal piece for him.
Absolutely. So there's contraindications to use of horses, big word. So individuals with history of cruelty to animals, again, that's objectifying the horse. That's talked a little bit about sexual perpetrator behavior, that power over. And so in the event that we would work with children like that, again, being very, very careful to protect the animal. Fire setters, of course, the being at a ranch, lots of hay, probably, is not a good thing to have someone who is actively fire setting. Heavily medicated youth, primarily because they can't be present in their body. And horses live in the now, right in the moment. And so you as a human have to be right in the moment with them. And so if someone's heavily medicated, then they just can't be as present as they need to be. And reaction time sometimes is critical because horses are flight animals. And so sometimes if that leaf rolls across and they think it's a gremlin, they're going to spook, and really needing to not have that horse step or hurt that child or adult or adolescent. Medically contraindicated. So if there is a reason medically why it would not be appropriate. On the concerning diagnoses, let me see, where is it? Oh, acute and chronic illnesses. So we do work with wheelchair-bound individuals with health issues. All of those can be worked with equine therapy. You just have to really set the stage in a very safety-conscious way.
There's an organization called PATH, which is the Professional Association for Therapeutic Horsemanship, which is where I did my training. And they a program called Colorado Therapeutic Riding Center here in Boulder does a lot of work with people with physical disabilities and are very safety conscious around riding. I'm not sure how much equine therapy they provide out there now, but it's a great place for therapeutic riding.
Absolutely. So acute danger to self or others, and blatant disregard for safety considerations. Again, keeping the client safe, keeping the horse safe is paramount.
But we didn't mention substance use. I know I want to get to the benefits here, but I don't know why that's not in our list of things we work with. But substance use, as long as someone isn't actively high in the moment. And I actually had a girl that really requested to see her horse that she'd been working with in therapy one last time before she was about to go in the hospital. And she had been using all night. And so in that case, I held the horse and I had her just sort of sit safely in the grass near the horse where we could breathe together and she could feel the horse. And that gave her the strength to go on and go into treatment finally after months of struggling. But when she was actively high, she couldn't interact with the horse. Same with, what Caroline was talking about with the medication. So again, I think find the right equine therapist and check this out. Don't sort of rule yourself out or in based on our list.
Right. I think too, just with Jenny, you're talking about with substance use, the horse is going to show you. The horse is going to show you something's not right. And again, that's the role of the clinician, to be able to say, they're heard and know that something's just not clicking. And so what's going on? So inquiring into what that is really important.
One thing that we actually skipped over, which is one of the diagnoses that we do a lot of work with, is depression, anxiety, and mood disorders. And I just, as it relates to depression, one of the things that we have found as therapists is one of the most valuable tools that anyone can utilize with another human being is the tool of validation. And when I think of someone who's going through depression, there's a tendency as a society to really encourage them to just kind of get over it and keep moving and get back on board. And the nice thing about horses is that they have an ability to meet you where you're at. We had a horse at the ranch who he really didn't like to be touched all that much. He wasn't a big love on him kind of guy. But if there was someone who was sad or upset, Tucker would go stand right next to them and hold the space for them and just kind of pour this amazing nurturing energy. And so I think they're really great with that. And somewhere along the line, when you're feeling really depressed, some horse does something cute and interesting or cool, and you start getting outside of yourself and seeing that there are some positives out there. And I think it's that outside time and that horse is a great modality to lift depression. Do you ladies have more you'd want to add on?
Yeah, I mean, I think emotional regulation, again, is a big thing that we teach. So I'm thinking about anxiety or even mood disorders with bipolar and mania. I think that horses will show you when you're you think that you're doing okay, or the way that you're doing it is you can't find any other way. Because that's a lot of times what we feel when we're truly depressed. We're really anxious of, I don't know how to do it differently. And sitting in an office and talking about it, that uses your frontal lobe, the part of your brain that does the logical thinking. Well, when you're truly depressed or anxious, you're in the part of the brain that the horse knows really well, which is the part that regulates your emotions, your needs, so the horse will identify with that part of the brain, see to the heart of the matter, and teach you to sort of persevere and have the skills to have that endurance of running the marathon of healing anxiety, mood disorders, and depression.
I think we've talked a bit about what equine therapy teaches: empathy, teamwork, educational skills, positive use of time, employment skill development. We've had a number of, in the past, of adolescents who are not only receiving equine therapy, but also learning how to be an employee of the ranch. So just, basic skills, coming on time, doing a thorough job, all of those pieces that maybe they haven't learned. And just really, even something as simple as cleaning out a pen. Are they doing it thoroughly? Grooming a horse, are they doing it thoroughly? If they're not, then that again gives you insight, and gee, maybe they need some skills to help them with that. Thinking and problem solving skills all the time on your feet with horses. You're doing that. You're processing. And then also the consistency and perseverance of regular attendance. I mentioned that. Learning to take direction. With your oppositional defiant, I worked as an adolescent or juvenile probation officer for many years. And that's a huge one. Address authority issues. Definitely work in that environment. You're going to need to, as a clinician, step up and set boundaries. And then what a wonderful place to be able to process what's coming up for that individual. Follow through skills, responsibility, communication skills, both verbal and nonverbal. Building self-confidence, assertiveness skills. I've been a 4-H leader for 30 years, and I always said that if one of my 12-year-old 4-H kiddos can lead a horse, set boundaries with the horse, they're going to do better out there in the world. They're going to be able to find their voice, and they're going to be able to be empowered by that. Delaying gratification. Relationship attachment to a living creature, that is huge. Something outside of themselves, and an animal or another being that's not in a power position over them, not a parent, not a teacher, really accepts them for who they are in the moment. And then teaches youth to stop, look, and think in real time. Anger management, conflict resolution, and self-discipline are all other skills.
So I know we have to wrap up here in the last few minutes. Make sure you send us your questions if you have any, but we just wanted to go through just a basic curriculum that we tend to structure both individual sessions around, and there are, of course, a lot of other options here. And the nice thing about equine therapy is it can look different each week. You go in with your ideas of what someone feels at the end of session, and then the horse shows you where the real healing is needed, and you just let it unfold from there. But usually in the first week, this is an 8-week curriculum. Usually in the first week, we do the introduction to the horses. We teach those body awareness skills and what horse feels best to me and why. I can't tell you how many of my girls will choose the big, beautiful, stunning black. Right now at the ranch, we have this beautiful black horse, and she is a pistol. She is not the safest horse, but all the girls are drawn to her. So teaching about who do you want and why to be in relationship. So the importance of body language with horses and how to read them, and of course, be safe. Week 2, we just look at self-care and grooming a horse, and not necessarily do it right, but what feels good to the horse and what feels good to you, and why do we take care of ourselves. Week 3, leading. So not pulling a horse around or making it do what you want or bribing it. Again, we're continuing to teach relationship building and learning our own communication skills, what works, what doesn't. Week 4 is lunging. So this is where you stand in the middle and the horse moves in a circle around you. It's derived from natural horsemanship that Karen and Caroline keep talking about in terms of how do the horses interact naturally? And it's a way of communication. And I find that when the horse takes a certain direction and can go that direction well, the person usually does well with goal setting. But when the horse has trouble moving, that person might struggle with their motivation in life. And usually the horse in this exercise will show the person, do you have trouble with goal setting or motivation or both? And we can work from there. So really quickly, week 5, we get a lot of empathy out of this exercise. Is what does it feel like to have this metal piece in your mouth and to have a bridle on in this equipment? And that, the decision-making skills are present there, transferring your learning, recognizing the needs of another and having empathy. Week 6 is Temptation Alley, and this works really well with our substance abuse clients. And we set up food and different things for the horse that there really will be a powerful motivation to go to. And how do we help them navigate around that in a healthy way that the human can then learn with their own sobriety? So improving coping mechanisms, dealing with peer pressure, developing a reliance on yourself. Week 7, we look at the journey ride. This is one of all of our favorite exercises where someone's bareback with their eyes closed and they have to choose a leader to lead them, and they have to trust their group around them to get them through. And so it's about relying and choosing a healthy community. And week 8 is about transition, how to go through grief, like we've already talked about, transitioning, how to know ourselves going forward. And I think I'll leave Caroline to do the final parallel as we sign off. Thank you, everyone.
So this is from a book by Mark Sprague, Where Rivers Change Direction. And I loved this. And when you look at the picture of this horse connecting and hugging with this person, we don't raise our own horses. We buy most of them at auction, and they come with their owner's bad habits. It takes time. We work them quietly, steadily, and they slowly begin to trust that they can survive in the world. Most of them buck because their hearts have been broken, and most of them men. We lose only a few each year to their histories.
Thank you all so
Yes,
much.
thank you.
Thank you.